Hi, my name is Erica Sutton. My student ID is 3648426, and this video is for anesthesia and surgical nursing for the fall 2025 semester. Thank you.
So in this video, I'll be going over all the paperwork that we have associated with our surgery and anesthesia. So to start off, I'll go over what we show the clients when they come in. So this is a treatment plan for a neuter, or an estimate for a neuter that we would show the owners, and this is for a cat neuter. So Orange here was getting neutered. So to show, this is everything that we do while they're in hospital. We do flea comb all the patients that come in just to make sure they don't have fleas, and if they do, we give them a capstar while they're here. For a simple cat neuter, when everything else is all good, blood work, pre-anesthetic blood work is just a CBC. And then this also, we charge them for the pre-anesthetic medication, which is usually the cat triple. And then we also do a block on the felines, as a testicular block on the felines. The castration includes the induction itself, so that's included in that charge. And then, and our anesthesia time is also included in that charge. And then we do charge them for hospital daycare, which is just them staying the day. We send home pain meds, which is Anesthesia. We give, since they're usually at the age where they can get more revolution than just one dose at a time, we offer to give them some more while they're here. And then if the owner decides they want to get have the animal microchipped while they're under sedation, we have that option, as well as any vaccines that they might be due for. So this is the estimate that we would show the owners. And then after they've confirmed that what they want to do, we show them the surgery and anesthesia consent form. So this one, we just usually write all their information down here and what they're here for. And then here we just check off what we would be doing. So for a cat neuter, we would just do the simple blood work. He's due for a vaccine. So we would just mark that off and give him the FERCP, and then we nail trim as long as the owners are okay while they're under sedation, and we microchip as well if they would like, so they can either accept or decline that. And then down here, we do have them put the best phone number to reach them at, and then any secondary contacts that we can reach out to if we can't reach the first number. And then here, if anything else arises or needs to be done, they can either check off that they trust for us to do whatever is necessary or needed, or they'd like us to give us a call before doing anything else that we haven't discussed. And then the last part down here is just if we can't reach them for any reason and we've called them, they either trust us to do whatever is needed in that case. The second option is only in case of an emergency. And then the last option is don't do anything unless we can reach out to them. And then they would sign at the bottom and date it. So that's what the owner sees and fills out when they first drop off the patient. Our next two sheets are for the actual surgery for us to deal with when they are here. So this one is just our surgery write-up sheet in general. So we would put the animal and all their information up here and what they're here for. If they're getting IV fluids, which just a cat neuter does not get IV fluids, we would write that as well as their fluid rate. This is a flea comb part to put that we checked and mark off their negative or positive for that. And then their pre-surgical blood work we just write up there. We also put down all the pre-medications that we use, as well as the induction that we used if we do use it, and then the anesthesia and how much we use. And then this part is just in surgery what we charge for. So our surgical suite kit if they go in the surgery room versus the dental room. The surgical packs we only charge for if they go into dental, and we're opening up packs for dental. And then cardio monitor is the EKG that we attach, and then any injections that we do for antibiotics or pain meds we also would write up, and then the surgeon will write up their notes in this area. Down here we mark off if they're going to go home with an e-collar. We do all post-op calls for everybody, what time they pick up at, and then the hospital daycare we just mark off as well. And then the last sheet is the anesthesia monitoring form that we do during the actual anesthesia event. So up here we would do all the patient's information, any pre-meds that they got, and make sure it's all also written on this page. We put what anesthesia or ISO level they're at in this area. We put their oxygen level, what tube size we use, and then what rebreathing bag size we use, or you can put non-rebreather. Here, the isoflurane we mark off we monitor every 5 minutes for vitals. So we would mark off every 5 minutes what anesthesia level they are at, or isoflurane level. And then down here is all the vitals we take. So we go over heart rate, or we monitor heart rate, SpO2, respiratory rate, CO2, blood pressure, capillary refill time, their temp, and then if they have an IV catheter in, we do put their fluid rate here.
And then down below, we would just keep track of the start time and the end time, the doctor who's doing the surgery and the tech that's monitoring when they're extubated, and then any comments that we want to write as far as how they woke up or anything else that might be important to the surgical event. And then the last part is we do have a cage card for everybody, as well as a name tag that we put on all of them to make sure that everybody is going in the correct cage and we can keep track of whose name is who, especially in cases where we might have similar patients staying together. So this is all of the forms that we would use and for any surgical events that happen at this facility. Thank you.
In this video, I'll be doing a pre-op exam on a canine patient. So this is Winston. He'll be getting neutered. So we just have to do our pre-op exam for him to make sure everything's good before he goes under anesthesia. So first, I usually just look at the dog themselves, see weight-wise how they look. He looks really good and he's not obese or underweight or anything. I do like to check their teeth and whatnot, especially before a neuter spay, just to make sure that they don't have any baby teeth in there. His look great. He has just minimal tartar on his back teeth. And then I can check their ears, especially with these longer eared dogs. His look really good. Your eyes look good. Yeah, and your nose. And then I will listen to his chest and his heart, and while I'm doing that, I'll get a pulse and a respiration, and make sure everything sounds clear as far as his lungs. There's no heart murmur or anything, especially in our Cavaliers. Everything sounded clear and good. His heart sounds good. His lungs are clear. His pulse was 120 and his respirations were 32. And now I'm also going to take a temp to make sure he doesn't have a fever or anything before we anesthetize him. So his temp was 100.4, which is normal and good. So overall, I'd give this patient an ASA grade or class 1. He's at low risk to go under anesthesia. As far as blood work to do before our anesthesia or before we sedate him, we would probably do a CBC and a Chem 11 just to make sure that'll cover our minimum databases, which are PCV and total solids, his BUN, ALT, and blood glucose. So that'll cover all that and make sure everything looks good as far as that goes. And then pre-med wise, we're probably going to use morphine and ACE for him as a pre-medication, since he's healthy and it's pretty safe for him. And then we'll induce him with some Tilazol, and that should keep him under enough to do his neuter, and then he should recover with pain on board and fairly quickly from everything. So that's what we'll use for this patient. In this video, I'll be doing an exam on a feline patient as their pre-op exam. So this is a little kitty that's going to be getting spayed. What I'm going to do is just kind of look her over. We'll do a CPR of her, and listen to her heart and lungs. She's a busy girl. So she's young. She looks pretty good. I'll look in her mouth first and get her gum color, her mucous membranes. They're nice and pink, and it's less than 2. Her teeth all look really good. Her eyes are looking good. And then her ears, they also look good. So now I'm going to listen to her. So I'll listen to both her heart and her lungs.
Okay.
And then I'll get a pulse rate on her heart as well as a respiration while I'm listening to her lungs. So her lungs sound clear, her respirations was 50, and her heart rate was 170. Her heart sounds really good as well. Next, I'm going to just get a temp on her as part of our exam to make sure she doesn't have a fever or anything. I know. So all you do is, I lubed it up already, and then you can just stick it in the rectum. Her temp is 100, which is great. So everything looks great. This kitty looks really good for surgery. I give her an ASA class grade of 1. She's pretty low risk for the anesthetic procedure. If her heart or lungs had sounded odd, or if her heart had a murmur, if her lungs had sounded congested, we could have done chest radiographs to make sure everything looks good before putting her under anesthesia. But since everything looks good, she's all good to go. In this video, I'll be demonstrating how to do a jugular draw on a canine patient. I have my materials here. I have alcohol, and then I have my needle and syringe. We're just gonna get a heartworm test, so this is already heparinized, and we just need a few drops of blood for it. So first, your holder will kind of straighten him out and pick up his head to lean it up. And then you can kind of put alcohol on the fur to push it down a little bit. Make the vein stick out a little. Okay. And then you're gonna put your thumb in the thoracic inlet down here and apply pressure. And then once you kind of feel the area, then you can take your needle off the syringe. I'll actually have to. Okay, and once I feel it, I'm gonna get my syringe, and then you want to put bevel up. You're gonna insert the needle into the skin, draw back, and then that's all we needed. So then your holder will hold off for a minute so that it doesn't flow. Okay, so in this video, I'll be demonstrating how to do a cephalic blood draw on a canine patient. I have my materials here. I have my alcohol, and then I have my needle and syringe as well. So we just need a heartworm test, so we're just gonna get a few drops of blood. I'm gonna grab the leg and pick it up, and my holder is gonna hold off pressure on the top by the elbow and kind of roll it so that the vein's right up top. I'm then gonna spray some alcohol on the vein, and then I'm gonna get my needle, and I'm gonna do bevel up and insert it at an angle and get some blood. And then after I'm done, I can hold off and pull out, and then your holder can apply some pressure for a minute or so that it doesn't bleed. And that's how you do a cephalic blood draw. Okay, so in this video, I'll be demonstrating how to obtain a blood sample from the lateral saphenous vein on a canine patient. I have my materials, I have some alcohol, and then I have my needle and syringe as well. So your holder is gonna hold off pressure behind the leg, and the vein runs this way, so that'll kind of have the vein pop. I'll spray some alcohol on the vein, and then I'll get my needle and bevel up. I'm just going to insert it into the vein, pull back, and obtain my blood. And then that's all we need. So then I'll hold off, and my holder will hold off for a minute so that it doesn't bleed. And that's it. In this video, I'll be demonstrating how to obtain blood from the medial saphenous vein of a feline patient. I have all my materials here. I'm going to be using a butterfly needle. I have the syringe to pull back the blood, and then I have my tubes as well, as if you want to clip the hair, you can. So first, I'm going to clip the hair in the area. So I'm going to clip this back leg, and this vein runs in the inside of the leg. I'm going to remove the hair from the area, so it's kind of running right there. So then I'm going to spray the area with some alcohol, and your holder is going to hold off on the vein by pushing down on the higher end of the leg so that my vein pops a little bit. Then I'm going to get my needle, insert the needle into the vein, And then now that my blood's coming, I'll just wait for it to get to the end of the butterfly line. And then once it gets to the end, I'm going to attach my syringe and then gently pull back. And this patient is sedate, so he's a little out of it right now. We actually only need enough blood for the purple top, so this will be enough. So I'll pull out. Your person can hold off the vein for a minute or so. And then I'm gonna put this in my purple top tube. That's how you obtain blood.
In this video, I'll be demonstrating how to obtain blood from the cephalic vein on a feline patient. So I have my materials, I have a syringe, and then I have some alcohol as well. So the holder is already holding her head. She is sedated. So the holder is going to hold off and roll the vein, apply pressure while rolling so that it's kind of right on top. I'll spray some alcohol so that we can see the vein a little better. And kind of feel for the vein. So now I can go bevel up into the vein at a slight angle, and cats' veins are pretty superficial, so they're going to be close to the surface. Okay, and that's all we needed. In this video, I'll be demonstrating how to obtain blood from the jugular vein on a feline patient. So I have my patient into position. A lot of times you can hang their legs over the end of the table. And then I have my materials. I'm going to use alcohol and then a syringe. So first I'm going to spray some alcohol. And then hold off at the thoracic inlet and kind of feel for a vein. Cats are very difficult to feel their little veins on. Okay, pick it up a little bit. Okay, so now, okay, so now that I see the vein, I'm going to bevel up, go into the skin. Okay, and then I can put that in my tube. In this video, I'll be demonstrating how to log a controlled substance in our controlled drug log. So I have my sheet here. I just took it out of the book that we had just to show. And then I have my patient that I'll be using. So this is Finn. We gave Finn 0.5 mils of telazole. So the way I would log that is first starting with the date, which is 10/21/25. His file number is going to be right on the file itself. So he's 362. So I would put 362 here. The client name is Jack Heiler. And the patient name is Finn. So the amount that's given was 0.5. We also put amount wasted, so if you don't use the whole drug, then you would put however much is wasted, but we didn't waste any, so you could put 0. And then this is the total amount is the total amount that's left, or the total amount is the total amount that was used. So we gave 0.5, we didn't waste any, so the total amount we used was 0.5. And then the new balance is how much is left in the bottle. So they come in a 5 ml bottle. This was a brand new bottle that we used. So the remaining balance would be 4.5 mils. And then whoever gives it initials it. So I put my initials here. And that's how you log a drug. In this video, I'll be going over all the parts of our anesthesia machine. So right now it's hooked up for a larger dog, but we'll start over here. We have our oxygen flow meter. So this will control how much oxygen goes into the patient. This is actually the hose for the oxygen. So normally we would plug this in up here, and then the oxygen can be turned on and be applied to the patient. So this always needs to be plugged in, which is the first step. And then you can, when you hook up a patient, you can adjust your flow meter. And then right next to it is the flush valve. So this is used to fill up the reservoir bag, and this flushes 100% oxygen into the patient. This is also used when you're leak testing the machine as well, and it's usually, you can get rid of your anesthetic gases after anesthesia by flushing them all out and unattaching the patient from the machine, flushing it, and then getting rid of all those gases and putting it back on the patient. Next we have, so there is a line that goes from the oxygen to our vaporizer then, and that vaporizes the liquid isoflurane that we use. So, and this vaporizer controls the amount of ISO that the patient gets, or the amount of anesthetic gas. So you can just, you would click this button and just turn it, and that'll control the gas pretty quickly. And then over here is where you would fill up the gas, and you want the level of it to, or the isoflurane, and you want the level to be in between the two arrows. We'll go over here is our pressure gauge. So this will be how much pressure is in the patient themselves, their lungs, when you give a breath. You never want it to go above 20. And then this is the these two are the unidirectional valves that are on the inhale and the exhale ports. So this one's the inhale port, this one's the exhale port. They are one-way valves that you got to make sure you're attaching things correctly to ensure that the patient is receiving and getting rid of their anesthetic gases. And these, when the patient breathes, you'll see the white part go up when they inhale, or up when they exhale, and down when they inhale. And then over here is your pop-off valve. So this vents any excess gases, and when you close it, you could give them a breath. It closes off the circuit so that they're not getting anything. And then when you open it, they can then take a breath. And you always want to make sure this is open during anesthesia, or if it stays closed and the patient is on the circuit and everything's on, the pressure can build up in their lungs and it can be very bad for them. Right here is the quick release for the pop-off valve. So instead of turning off the pop-off valve, you could press this down instead, and that'll basically do the same thing as the pop-off valve. And then you can give a breath that way, and once you're done, you just let up and it's back open so that you don't have to remember turning this back open. Over here, this is where we'll connect this part to our scavenger. We do have an active scavenger on our wall, so we turn it on before every procedure, and it connects directly to this and goes outside the building. The other scavenger that we have is attached to the anesthetic machine, so that's just a charcoal canister that we can, if we have to transport this machine anywhere and we're not next to the active scavenger, we can connect it to that, and that way we're able to move around anywhere we want in the hospital. So right now, like I said, we have just a larger dog set up right now. This is our rebreathing system and circuit. So we have the large tubes on here. If we were to change it to a smaller animal, what we would do is you can either leave these on or take these off, but you could take these off. And I have my other circuit here. So this is the non-rebreather. So say you have a dog or a cat that's under 15 pounds, we can use this. And what you're gonna do is I'll connect it to the charcoal canister. So I can attach my in there, and then so this machine has a part where you unplug this, and this will reroute the circuit so that it goes straight to the non-rebreather instead of going through the circuit. So now I have the non-rebreather set up. I can use that for a smaller patient. Some other things that we can use is we do have face masks. So if a patient is not intubated and you want them to have oxygen, you can put a face mask over them and deliver them some oxygen without having to intubate them. Or if there's an aggressive dog and you can't get them down with injectable anesthetics, then you can use these to give induction quickly and then remove these to intubate them. And then the last thing is, say you have a fractious cat or anything, you can stick them in an induction chamber, and you can attach our tubes for oxygen and anesthetic gas, and you can flush enough anesthetic gases in here to sedate them, and then you can take them out to intubate. So that's what we would use for that. All right, and that is it. We do have other size bags, so according to the patient weight, you can change the bag. And then we also have our tube inflator and our lube up here that we can keep. And then this is our CO2 absorbent canister. So these pellets will change to purple when the CO2 is, when the granules have pulled enough CO2 that they've used up their use as far as that goes, and they're very brittle, so it does need to be changed. We change them about weekly. And that's it. Thank you. So for our oxygen supply, we do use 2 large tanks of oxygen. So we check these before every surgery day, and we just make sure we always keep one off, and then we keep one on. So when one empties, we can switch it to the other one, and then we can get this one refilled, so they'll replace it for us. So that's our oxygen supply. In this video, I'll be demonstrating how to perform a leak test on an anesthetic machine. So I have everything hooked up. I have my tubes on and my reservoir bag. So now I can leak test it. So what I'm going to do is first I'm going to put my finger over the opening. You can also put the palm of your hand, but it's just easier to put your finger. And you want to make sure it's covering the whole opening. Next, I'm going to use the pop-off valve, and I'm going to close that. So I'll turn that all the way till it stops. And then I'm going to use my flush valve to flush oxygen into my reservoir bag. So I'll flush it, and now I'm going to do it until it goes up to 20. So now that it's there, you're going to hold it for about 5 seconds, and you want to make sure that it's holding pressure. It can go down a little bit, but if it's really going down, you want to make sure that your bag is on tightly. All these are connected tightly, and everything else is connected tightly. And as long as that's doing good, then you can open up your pop-off valve again. You always want to make sure you open this up at the end. You can then squeeze the bag so that if there's any gases in the machine, it vents out of the pop-off valve, and then you can finally let your finger up. And that's how you check a machine. In this video, I'll be showing how to give a sub-Q injection. So I have my patient here. She's sedated. I have just 2.2 mLs of saline in a syringe, and I've already changed the needle, so this is a new needle. So what I'm going to do is to give a sub-Q injection, you want to tent the skin, and then you go at a little angle in between that. You pull back to make sure you don't have any blood, and then you can inject. So what I'm going to do is, and you can pretty much give these anywhere. I'm going to give them their shoulder. So I tent the skin. I'm going to go between my fingers. Just tough skin. I'm going to pull back. I got negative pressure and no blood, so then I'm going to inject. So she got that sub-Q injection. And then, so in this video I'll be showing how to do an IM injection. I have 0.2 mLs of saline in a syringe. I've already changed my needle after pulling that up. So you can give it in a few places. We like to give it in the back hamstring muscles, or the semitendinosus or the semimembranosus muscles. So there is a sciatic nerve that runs down this area. So what I like to do is kind of use my thumb to move that out of the way and really get the muscle back here in my hand. So now that the muscle is in my hand, you can feel it right here. So I'll take my cap off my needle, and then I'm just going to go kind of in the back to avoid the sciatic nerve. I'll pull back to make sure we don't have blood, and then I can inject. And that's how you give an IM injection. In this video I'll be demonstrating how to place an IV catheter in the cephalic vein. This is our patient, and this is my preceptor, Dr. Heiler, that's going to be observing. So I have all my materials here. I have the clippers, my catheter, I have chlorhexidine and alcohol scrub, and then I have all my tape pieces here I'm using for them, as well as my IV bag. So first I'm going to grab the leg. I'm wearing gloves, and I'm going to clip the area. So you kind of want to go as low as possible. So I'm going to stay in this area. And since she's hairy, we're going to clip all around her leg. And then you just want to remove all the hair from the area so it doesn't get in your tape or anything. Okay. And then you are going to scrub it at least 3 times with your scrub. So you're going to start with chlorhexidine, and you do want to do the target motion, so just kind of scrub outwards. And then you can go in with your alcohol and do that at least 3 times. If they're dirtier, you can do it more than that. Still has this on. Okay. And then I am going to take my gloves off so it's a little easier. So now that the area is prepped, you can look at the vein and see what kind of catheter size you would like to use. I'm going to use a 20 for her. So I'm going to loosen the cap up a little bit, and then also loosen my catheter up as well, because they can be hard to take out. Now that I have that all ready, my holder is going to occlude the vein at the elbow, so they apply pressure and twist outward to put the vein on top. Okay, and now I'm going to grab my catheter, and then you want to just go into the vein. So I'm getting a little bit of flash, and once you get the flash, you want to advance your catheter, and then you can apply pressure up top, and just don't touch the insertion site. My catheter's in. Now I'm going to tape it. So the first piece, you can grab a skinny piece of tape and put it underneath the catheter to secure it. And then you just go around and tape it. And then you want to grab your next piece, which has a notch that you can slide under the catheter. Tape it like that. Okay, and then I'm going to attach my IV line as well. So to attach the line, I can just hold pressure here and attach the line. And then I'm going to put a seatbelt around that to keep it on. And then your last piece of tape, you can put your IV line. If you have a T-port, you can put it around the T-port to attach it. And then just put that around. And then I have some flush. I'm going to flush the line just to make sure that it's patent. So in order to do so, I'm going to clamp off my IV line and flush the area. And as long as it flushes good and you feel it, then you're good. If it does bubble up or anything, that could mean that the catheter came out and the vein is blowing, or it's going sub-Q. So then you want to remove everything and try again. And my last step is I'm going to put a little bit of vet wrap around it, just to bandage it in place. And then that's it. In this video, I'll be demonstrating how to place a lateral saphenous IV catheter in a patient. This is my preceptor, Dr. Heiler, and he'll be observing me do it. So I have all my materials here. I have my tape that I will put on. I have my scrub and alcohol that I will use to scrub the area, and then I have my clippers as well as my catheter. So first we'll clip the area, and I'm also wearing gloves.
She has a lot of hair. And then I'll move my hair out of the way. And then I'll scrub my area. So you want to alternate between we're using chlorhexidine scrub and alcohol. So I'm going to first do my chlorhexidine and do it in a target motion. And then you can do your alcohol. And then you want to do at least 3 of them to make sure the area is clean. If the dog is dirty, you can do more than 3. So that my area is clean, I'm going to take off my gloves. And I'll be using a 22 gauge catheter, so I already have my catheter open. I'm just going to make sure everything's ready for me to place it. Okay. And then, so the vein's running this way, so I will insert my catheter. I'm going as low as possible so that in case we need to and then once you get a flash, you can then advance your catheter. And then you can put pressure over the area. Just make sure not to touch the insertion site. And then I'll place my skinny piece of tape on the area. It's okay. I know, it's okay. Move my needle out of the way. And then I do have a notched piece of tape that you can kind of put underneath it and tape that over the area. And then we don't put a T-cord on just of our dentals, so I will attach the IV line to it. And again, you can hold off some pressure so that it doesn't bleed. And just screw that on. And then my last piece of tape, I will put any way that works. And then last, I will put the no chew around it, and then I will flush my catheter. I do have my flush here. So you want to make sure that the catheter is patent, so you want to flush it a little bit. So you'll feel it kind of in the back area. And then if it's not in or it's blown, then it'll start bubbling up. So the way you know it is, you feel it going through the vein. That's how you place the lateral septum. In this video, I'll be demonstrating how to intubate a patient and induce one. So I have all my materials for induction. I have my flush and then the propofol that we're going to induce with. I have my tube that is wrapped up in some gauze that has sterile lube on it, and then I have my tie as well. So for induction, we're going to first flush the catheter to make sure everything's good before we put anything in it. Okay, everything's good. And then we're gonna use the propofol to induce. So we're gonna give this slowly and titrate it to effect. Just a little bit at a time. And the fluids are running, so that'll help push the propofol in a little bit. Gonna feel for her jaw tone. She still has a decent amount. Okay, so I'm doing all the propofol. I'm now gonna flush afterwards to make sure all of it's out of the line. Now we'll check her jaw tone again. So it's a lot better than it was. So I have my light above me, and what you're gonna do is get your holder to hold up the top part of the jaw. She's a big girl, so she has a big tube. And when determining how far you want to put the tube in, you do want to measure from the thoracic inlet to the canines. So this will be pretty good for her. And I'll stop around here once I intubate her. So I'm going to take the tongue. I'm actually going to use a piece of gauze. Pull the tongue downwards, and then you want to kind of, the epiglottis is going to cover the larynx or the trachea, and you kind of want to push up the soft palate and then push down on the epiglottis, and then go in between the two cords. Hers is very long. Sometimes they'll cough when they're in. So, and then once I have it in, I'm going to tie the tube together in the mouth. So I'm gonna put this over there, tie it down tight, and then you want to tie it, you can either tie it behind the head or on top of the nose. So we're going to tie it here. Make sure it's on there good so it doesn't slide out. Okay, and once we're ready, you position the patient wherever you need her. So she's going to stay in dorsal recumbency or ventral recumbency. And then we're going to attach her. Put on the oxygen. We're going to keep her at 1, and then we're going to inflate her. So when inflating, we use just a syringe, and you can inflate the tube. So we don't have any pressure gauge to measure how much, but you want to make sure you're not pushing it so hard that this is really sturgid, and you don't want the plunger to be coming back at you like crazy. So I'm going to keep her at that, and then we can put on the ISO. You're gonna put her on 2, and then in order to listen for any leaks, we can give her a breath and see if we hear anything. So if you hear anything coming out, then you know that your machine might be, or the tube might be leaking and needs to be squeezed a little bit more. So to give a breath, you want to push this button and squeeze the bag, and you don't want to go above pressure 20, and then you're gonna listen. Okay. And I didn't hear anything coming out of her, so that means that it's probably a good pressure in there. And then in order to make sure that you're not in the bronchi and you're just in the trachea, you can listen and somebody can give a breath or two to make sure that you're in the right area. So give a breath. So you just listen to both lungs. And I'll see the other one. And you want to listen for equal breath sounds. So that sounds good. I'm going to loop the eyes as well. So. And she has no reflexes, so she's pretty good under anesthesia right now. So we'll just keep monitoring her, and then we'll prep her in this area, and then we'll move her to the surgery suite. So in this video, I'll be demonstrating how to surgically scrub a patient for surgery. This dog is getting spayed. She is canabone, so we have objects on both sides. So I'll be clipping and cleaning her for a spay. I have my gloves on, my scrub jacket on, and then I have clippers and my scrub solutions that I'll be using for the scrub. So I'll start by clipping the patient. So now I'm going to express the bladder before I scrub so that I'm not touching anywhere in the scrubbed area. So I'm going to just bunch this towel up underneath her so I don't get anything on the towel. I'm going to palpate her bladder. Okay. So, are you on video? Oh, okay.
Okay. Yeah, she's not ready yet. She has to go tell her husband. So you're going to surgery if you do that.
Well, I'm gonna have to get a little bit of that on because it's only supposed to be a little bit left on the bottom.
Okay. So that was all she had. She had a pretty small bladder. So now I can put the towel back. And I'm actually going to clean her up a little bit. Just because she is having some loose stool coming out.
And just subtract all of these and make sure that it's down.
Looks like she's back in there.
Okay, she's back in
Yeah.
there. Okay. Okay. Yes. Oh, thank you.
Okay. And now that she's pretty clean, I'm going to scrub the area. So all my hair is out of the way. We have two different solutions that we scrub with. We have a chlorhexidine scrub, and then we just have dilute regular chlorhexidine that we do in place of the alcohol or the saline. So first I'll take my scrub solution, and what I'm going to do is start in the midline where the incision is going to be, and you can go back and forth, and then just go in a target motion around, and don't go back over that midline area. And then just gonna do the next one. So this is our chlorhexidine, and again just gonna go in a target motion around the surgical incision, and we're gonna do that at least 3 times. If she's dirty, we can do it more.
Are you using the picture on my 1 and 2? She's just waking up. I'll just check on her like every 10 minutes. Okay. Thank you.
Well, we might have enough to one there. That looks like
I'm
more.
just gonna do it one more time because she was pretty dirty.
Yeah, she's not.
Okay, she is all done with that, and now she's ready to transport. You can pause. Now that our patient is scrubbed and ready to go to the surgery room, I can remove my gloves and then also remove my scrub jacket just in case any hair is on that. So we're going to disconnect our patient from the machine. So we'll turn off my ISO and my oxygen, disconnect, and then we will carry her. So we have a new towel for her. I'll make sure her head is under me so that it's not dragging at all, and then we'll carry her to the surgery room. Okay, so now that she's here, we will first hook her up to the ISO and also get her set up on a table. So one person's usually hooking her up to the anesthesia machine while the other person is hooking her up on the table and to the monitors. So I will tie her legs in. I like to go, so I go below the elbow for the tie and then kind of through the arm, and then you can warm up a little bit. Just, you don't want to apply too much pressure when you're
doctor's not dealing with the head area, we can put it on the tongue. So I'll just put the SpO2 on her tongue. And then next I'll attach my EKG. So when you attach the EKG, they are color coded, you can see here. So white goes on the right arm of the patient, black goes on the left arm of the patient, and then red goes on the left leg of the patient. And then you can spray them with some alcohol. And then I will attach my blood pressure monitor, so we can attach that to one of these front legs. Into my cuff. And then press the blood pressure. I'll attach, we do have a capnograph. So I can attach this to her tube. This just slides into the tube. And then the last measurement we have is our thermometer. So this we put down the esophagus. So I'll just slide this down and it'll go right near the tube. And should go down pretty easily. So that is in. Just get shipping off. And then I can do her legs, tie her legs as well. Okay, that is all set, and then we can put our lights on for the doctor to the area where he'll be cutting. And then I'll also do one final scrub. So I'll put our gloves and then I'll scrub my eye. Just in case any contact was made through when we were moving. I'll do one more. So now that that's all done, we are ready for the doctor. So while we're waiting for the doctor, we can monitor the procedure. So our monitoring, we monitor all the parameters that we've already attached to. So the EKG, we monitor the SpO2, the heart rate, the respirations, the CO2, blood pressure, and then also we keep an eye on the gums. So I'll make sure all the readings look good and everything's reading okay. Her isoflurane is on and her oxygen is on, so that's all good. And we'll see. We'll just keep monitoring. So I'll take her vitals now. So she's on 2 ISO. Her heart rate is 89 and her SpO2 is 99. Her respirations are 10 and her CO2 is 47. Her blood pressure is 80/39. That's a little low, so we'll try to turn her down a little bit. Her gum color is pink and looks good. And then her temp. video, I'll be demonstrating how to place an esophageal stethoscope in a patient. So your patient's going to be sedated for this, which he is, and he is currently hooked up to the anesthesia machine and has a tube in his trachea. So I have my materials, I have my esophageal stethoscope, and then I have some lube. So I'm going to lube up the end of it just to make it a little easier to insert. And then what you're going to do is kind of open their mouth up, and their esophagus is going to lay kind of right on top of their trachea. So I'm going to, with the tube in, you shouldn't be able to go down the trachea, but kind of move it along the top of the tracheal tube and just pass it through there, and it should go in pretty easily, especially because this is pretty small. So now that went in easily, I can listen and just make sure it's in. It sounds good. If you can't hear anything, you could go in a little too far, so you should just slowly pull it out until you hear the heart. He's a large dog, so it was pretty good. I could hear the heart that way. And then when you're done, you could just pull it out. Right. And then if you were to place a gastric tube, pretty much the same thing, but a gastric tube is a lot bigger, so you really got to straighten out their neck area, and it's kind of harder to push into the back. But that's just how it would differ from the esophageal stethoscope. In this video, I'll be demonstrating how to perform CPR on a patient if they go into cardiopulmonary arrest. So this patient, if we were in surgery, is already intubated, and if they're on the table and they go into cardiopulmonary arrest, you can either give them breaths on the anesthesia machine, or you can hook them up to an amnio bag. So we have our amnio bag, it's hooked up to the oxygen, so you would just hook it up, and somebody can give breaths every 10 seconds while somebody else starts compressions. So I have a stool here, so I can stand on the stool, and you want to get higher than the patient. And what you would do is kind of go right over behind their elbow, and you can use two hands, and you just do compressions. And then you want to look at your EKG to make sure that you can see the waves on the EKG doing it as well. And then somebody's giving breaths every 10 seconds while you're doing compressions. After a minute, you want to stop and listen for a heartbeat and make sure you're monitoring with an EKG on a machine. Thank you. In this video, I'll be demonstrating how to scrub in for a surgical procedure. So I already have my things laid out. I have my gown opened and my gloves set out as well. And I have a cap and mask on. If you need booties in the surgical suite, you can put those on now. I've removed all my jewelry, rings, earrings, and necklaces, and I have washed my hands with soap and water. So now that that's all done, I can go over here, and we use the waterless scrub-in to scrub in. So you don't require any water, you just rub the lotion in. So I'll get one squirt onto one hand. We're gonna do 3 squirts total, and you wanna get your fingernails into the solution and rub it in there to get all under your nails. And then you can rub the solution on your hands. You wanna make sure to get all in there. And then what you're gonna do is go down your arm with this as well to your elbow. And you don't wanna go up and down, you just wanna kinda go in a circular motion down your arm. Okay, so now that that's all done, I'm gonna do the same thing to the other hand. I'm gonna get a squirt. Again, move my fingernails in here. Get it in there. Wipe them all in that hand. Coat the hand well. And then again, move down the arm. So now that I've done those 2 squirts, I'm going to do one last squirt. And it doesn't matter what hand you put that in. And then this one's just going to stay at your hands and wrist. So you're just going to move it into your hands, really get every surface of your fingers, every side in the crevices, and only stay above the wrist until it's all dry. So it could take a few minutes to do. Okay, so now that we're pretty dry, we're gonna go over here and pick up our gown. So you can do that by grabbing the 2 strings. And you want to bring it away from the table, kind of shake it out, And then you can put your arms into the sleeves. One. And two. And you do want to leave it so that your fingers aren't sticking out. So now I can come over to my gloves and I can pick up my gloves. And I want to do this by opening it up in this way, and just make sure you have your, and then this is the open glove technique, and you can stick your hand in here. And then you can bring down. And later on you can, or now you can kind of pull your thing down so that your fingers come out of the sleeve. Okay, and then I can go over to this one, and you can grab this one as well. And you can stick it this way, bring your fingers kind of out of the glove, and then just slip this glove on like that. And then after you've gotten both of them in, you can kind of readjust as needed. Your hands are sterile at this point, so you can use them, and then you can touch this area to kind of loosen everything up. And then just have somebody tie you in. All right, so now that I'm scrubbed in, I'm in the procedure. This is going to be a dog canine neuter. The pack is already opened up, so we only have a one-layer drape so that an unsterile person opens up the drape. There's nothing for me to open up afterwards. And then they also place our drape that we'll be draping the patient with, our blade and suture, on the table as well. So first, I will move my drape over, and I'll kind of take out the instruments so that I can use them. So first, we're going to be using the towel clamp, so I'll just have them there. And I'll take my drape and open it up. And now that I have it opened, I already have a pre-cut hole, so I'm going to kind of grab the inside of the drape like this so that my fingers never touch the bottom side, which is going to be non-sterile. So then I can go over this way, and I can place it over the patient. Careful not to put my arms over the actual area that will be doing the incision. And then you can kind of readjust as needed. So right here, so this is about where they're going to be. And then you want to grab your towel clamps. And you just want to clamp the drape onto the patient. So after we have that done, then we can set up the rest of our instruments. So I will take everything out from under this drape and put them on top, as well as our gauze. And I like to kind of put everything together with what they go with. So I'll put my hemostats together, my scissors together, my needle drivers, and then next we're going to load the scalpel blade. So you want to take your needle drivers and you grab the top of the scalpel blade towards the pointy tip, but on the non-sharp side, and then you hold your scalpel blade or your scalpel handle and you just slide it on there just like that. Then you can let go. So now your scalpel's ready. I'll just set it there, and then my whole area is ready, and we're ready for the doctor. All right, so now that the doctor's in, we can start the procedure. So as he tells me what instruments he needs, I'll pass them to him.
Scalpel.
Okay, so when you do the scalpel blade, you want to kind of point it towards you and point it away, and then you can hand it to him like that.
And sponge, please. Need a driver?
So in any procedure you're in, you do want to make sure that you're staying in the sterile field. So you always want your hands above your waist and above the table. You never want to put them below the table. If you accidentally drop any instruments, then you just call that instrument non-sterile anymore and you don't reuse it. And if you were to puncture a glove or anything, you do have to replace your glove. So somebody can either put a glove over your glove, or they can take your glove off and they can re-glove you themselves. So you just want to make sure you're staying in the sterile field. Don't touch your mask or hat to rearrange anything. Only touch whatever's over here. So, and his area is getting a little bloody, so you can also help the doctor by blotting some of the tissues. You can kind of blot the blood away a little bit for them while they are getting resituated with their hands.
Scalpel,
And you want to make sure that the tissues are also staying hydrated. Since this is a neuter, they don't really dehydrate easily, but if you're in a bigger area, then or in a bigger procedure, then you can hydrate the tissues by applying saline. You can have a bowl of saline with gauze, and you can tap the areas needed. But for this one, you don't need to do that.
Scalpel blade again, please. Again, scalpel again. Scale. Needle driver. Forceps. Needle driver.
And in this case, again, you can blot the tissue of the blood just to get rid of some of that for the doctor to see better. And it's very hydrated, so we don't have to hydrate anything. But if so, like I said, you can just use a bowl of saline and kind of squirt it in the area, or soak some gauze in saline and dab the area. Okay, here we go. So this is a cat neuter that I'm participating in. Just monitoring him while he gets neutered. We have the oxygenation going. And since this is a quick procedure, we don't usually do it in the OR. So I kind of just keep track of his heart rate and respirations. So I'm currently monitoring a feline various hysterectomy. Just making sure she's doing well under anesthesia, taking down all her vitals, and making sure she's doing good. So every 5 minutes we check her vitals, and I'll record everything that's going on. I'll make sure her heart rate feels good, and check all her pulses and everything, and make sure that's good. So now that we're done all our procedures for the day, I am in the surgery room. So I'm going to start, I like to start with all the cords, so I'll tidy this area up. I wipe down all of our cords with some alcohol. And then we just kind of roll them up nicely and hang them up. So I'll do the next one. And just the SpO2 piece, I like to make sure you're wiping in there. And wiping the cord down. Take that out of here so we can clean that, and then I'll roll this up. And then our EKG leads. I like to open all of them up, clean them out. And then also wipe down the cords. And if you see any blood or debris, then wipe them down a little more. So then we're going to clean that. I'm going to stick this extra gauze in here. So now I'm going to wipe down the surfaces, and I'm going to we take out our anesthesia machine after the procedures, and that way we can clean it out there. We wipe everything down, take the tubes off. So and then you unplug all the cords. So any cords that are plugged in the surgery room, we also want to unplug. So I'll unplug those. That includes the surgery table since that's heated, and then I just hang up the cords. I'll leave our anesthesia machine in here for a moment. I'll wipe down, we'll use kennel saw to wipe down the table, and then I'll also spray down the trays as well. The other thing is I'll actually spray down here because a little bit of blood got down here. So we really want to get all the surfaces. And then I'll also pick up the mat so we'll clean the mat, and then we'll also clean under the mat as well. So I'll just hang this up over here. Now that this is stacked for a while, knock this down. I'll wipe my tables down. And then I'll spot clean any walls. If any blood got on the walls, you can spot clean those as well. So I'll just go down here with this. So now that that is all done, I'll grab my broom, and we do sweep and mop the surgery room after each day. So I'll sweep and mop the area.
Are you gonna go now too? Do you want anything else?
And then I'll come back, I'll take all of our tubes off the machine. So that we can clean them. And then we do spot clean these as well, so I'll leave them out here so we can clean these later. And now that everything, I can turn the light off. Now that everything's wiped down and cleaned, I've already swept, I can mop the area. We do change this every day. So this is a brand new bucket of mop water. And I can just mop the floor. And any sharps that needed to be disposed of could be disposed of in the sharps container over here. I'll also take this out. So now everything is done and the surgery room is ready to close down for the night. In this video, I'll be demonstrating how to clean surgical instruments. So I have my instruments in the sink currently, and I have some water in there, and then I've also already put our instrument cleaner in there as well. This is the Miltex instrument cleaner we use that also has lubricant added into it. So what you do is it's 1 ounce per 1 gallon of water, and you can put, so you can fill the sink up, put the lubricant in there, soak the instruments for at least 5 minutes and up to 1 hour. And then you definitely want to clean them and go to the ultrasonic cleaner from there. So these have already sat for a little bit. Now that they've sat, you do want to rinse off all the instruments to make sure the cleaner is off of them. And I do that with a light toothbrush, and that way I just rub everything else that might be left on them off. I'll put them in my little bin that will go in the ultrasonic cleaner, and then I'll put them in the ultrasonic cleaner after we do this. So I'll start by, I'll turn the sink on, I'll turn it on this side, and I'll grab my instruments and just lightly rinse them off, and then I can put them in the basket. So cleaning off any debris that's on them. And you want to make sure that you're opening the instruments when you're doing this as well, because a lot of times blood will be in the, where the instrument meets in the middle. So you want to get that really well. Rinse that off. Okay, so now that I have my instruments, that was all that was in here. I can then take this, I'll bring it to the ultrasonic cleaner, and we'll put it in the ultrasonic cleaner. So now that our instruments were washed off of the sink, we can put them in our ultrasonic cleaner. So they're already in the ultrasonic basket, so I'm just going to stick this inside. You want to make sure that all the instruments are covered with the solution in there, and then I'm going to put my lid on. And we use heat, and then we use degas. So that'll go for about 12 minutes, and then we'll come back, take them out, rinse them off, and then let them sit. Alright, so now that these have gone through the ultrasonic cleaner, I can rinse them off with just some water. I lay them out, and since our instrument cleaner has lubricant in it, we don't have to milk them at the end, so they just dry and then they're ready to be packed. So I'll just rinse them under some water. And then we can take them out and just lay them over here flat. And they're all good. In this video, we're demonstrating how to wrap a surgical pack. So I have all my materials here. I have the drape that we'll be using. I have all my instruments. I've already put them all nicely into some surgical instruments, and then have everything on the sides. And then we put 12 gauze in the pack, and then my indicator strip. We don't put any towels in our pack. So now that that's all ready, I can start to fold it. So what you're gonna do is start with the bottom part of the surgery drape, and you wanna make sure everything's kind of snug when you're doing this. So I'm going to bend it over my instruments, and then you do an envelope fold. So then you're gonna fold it back. And then since this is long and it's coming kind of across the pack itself, I'll bend it again, and then again envelope fold it so that it looks like that. So now that you have it like this, you want to start with the sides. It doesn't matter what side you start with. I'm right-handed, so I'm going to start with this one. So I grab this one, and you bring it over, and you do want to make sure it's snug. So try to pull as much as you can so that it's not too loose. And then now that we have it like this, again, you're going to fold it backwards as an envelope fold, but this one's a pretty large drape, so then I always do another fold and fold it like this so that they can grab it. Same with the other side. After you've done one side, you just do the other, fold it over, and then I straighten everything out, and again fold it backwards and do it one more time just so it doesn't stick out of the pack. And then the last one, I turn the pack so that it's facing me, and this area is facing me, and I kind of straighten everything out so it looks like what I want it to look like. I grab this, and you put it over. And then from the folds that you already did, you kind of make like a pocket. So you're just going to tuck the end of that into the pocket until there is a tiny bit of the drape sticking out so that they can grab it to open it. Now that I have it like this, I'm going to use my indicator tape, and I always make a tab on it so that you can pull it off easily. And we put 2 strips of tape on. So this one's one, and you want to put it around the opening to keep it closed and secure. And then my second one is just gonna go right here. You could also just do one piece of tape as well. And then after I'm done that, I am going to write what kind of pack it is. So that was a spay pack that we used. And then I'm also gonna sign and date it. So my initials are ES, and then the date is 10/23/25. Okay, and that's how you wrap a pack. In this video, I'll be demonstrating how to fold a surgical gown. So I have my surgical gown here, and I have the table that I'll be doing it on. So first, I'm going to kind of take out my gown, and what you're going to do is kind of drape the gown over the table as if it was going on a person. So the inside of the gown goes to the table. And drape it over. So next, I'm going to get the arm sleeves, and I'm going to kind of straighten them out on top of the gown. There are a couple different ways to do this, but how we do it is then I'm going to meet in the middle with one side, and I like to straighten out the sleeves a little bit. And then with the other side, same thing. You're going to meet in the middle and kind of straighten it out with the sleeves. Just make sure it's nice and flat. And then make sure all your inner ties are kind of just laying flat in the gown as well. So then I'm going to take one side and put it 3/4 of the way over. And then I'm going to take the opposite side and then fold it till it meets the other end. So now it's pretty, it's a thin gown, and now we can accordion fold it until we get to the end. So what I'll do is I'll start at this end and I'll just accordion it. So I go over and then under and over and keep doing it all the way down until I can flip it over this way and do the last accordion fold. And then I have my ties, so I'm just going to lay them on top so that the doctor can grab the ties when they open up the gown and put it on. Okay. All right, so now that I have folded my gown, I'm going to wrap it down into a pack. So I have my drape that I'll be wrapping it with, my indicator strip, and then my gown that I've folded. So I'm going to put that in the middle of the pack. And then I'm going to put my indicator strip kind of in the middle of the gown to keep it there. And then if you want, you can put a hand towel on top of the gown as well at this point, but we use the waterless scrub, so we don't use hand towels. So now I can fold it. So what I'm going to do is take the bottom part, I'm going to fold it over. And do an envelope fold. So you do that so what I did was I put it over and then fold back. And then since this tab is extra long, I'm going to fold it again and fold it back just so it's a little shorter. And then I'm going to do the same thing with both my sides. It doesn't matter what side you start with. I'll start with this side and I'm going to fold that over. Can you get me tape? And fold that back to envelope fold it. And again, this is really long, so I'm just going to fold that back over and then fold it like that. And then same thing with this side. Fold it over, fold it back. And then again, just so that it's easy to grab. And then this last part, I am going to take this, I like to flatten it out, and then I'm just going to take it over. And now with the other folds that you've made, you can tuck it in. So I'm going to tuck it in that area. And a Sharpie. And then I'm going to take my tape and I'm going to put it on the drape. And we only use one drape for our surgical packs. You can use two. And then we use 2 pieces of tape. So I'll put 2 pieces of tape. Okay. Pause. So now that I have my tape on, I can write everything that I need to on top of my tape. So I'm gonna write, that was a medium gown. You do wanna pay attention when you're, before you fold it to make sure you know what size it is. So medium surgery gown. I will write the date. Today is 10/28. And then I will put my initials as well. And now it is ready to autoclave. 3, 2, 1, go. In this video, I'll be discussing the autoclave. So our autoclave is a gravity air displacement sterilizer. So what that means is we use distilled water, and when we add it into the autoclave, we add it in here. And then how you know it needs more is there's this red and green area on here. So as long as it's in the green, you have enough water in the sterilizer. If it's in the red, you need to fill up here and add more distilled water. So once you turn the autoclave on and the water goes through, it fills up with some water at the bottom, and then that water, as the temperature gets hotter, it turns to steam, and it steams up and sterilizes any of the packs or pouches as steam. So that's how ours works. How to load one is, so this is used for any surgical instruments, surgical packs. If we put them in packs versus pouches, we turn it on to different settings. But that's in gowns. So anything like that we would use to sterilize for the surgical room and procedures. So I've already loaded the autoclave, and how you load it is you want to add your things. There's multiple shelves in here, and you want to add your packs in one row. You don't want to top them on top of each other, or they won't sterilize properly. And these all have some room in between the packs as well for the steam to go through. So I loaded all my layers. None of them are touching the rack above them, and they're also not touching the side of the autoclave. If they are in the way of the side of the autoclave or they're touching on top, again, the steam won't get through to get everything as sterile as it can. So all one layer, everything's here. And then we also have this last little rack up top that I added things to as well. Again, making sure that there's small ones that fit in that area. So now that I have my my autoclave all packed, it is ready to run. So what you're gonna do is, it has a little handle, you just go up on it, and sometimes this one is a little older, so you just push and then it'll lock into place. So now the door is shut, and we can pick our sterilization. So all of my instruments were packed into packs. So I will be using the pack setting. We also use pouches such as these ones, which are going to be on a different setting. The packs are run at 250 degrees Fahrenheit with a pressure of 15 psi, and they're sterilized for 30 minutes and then they dry for 30 minutes. Whereas the pouches are at 270 degrees Fahrenheit with a 27 psi, and they're only sterilized for 5 minutes because it's easier for the steam to get in there, and then they dry again for 30 minutes. So I am going to pick my pack cycle. It says right here 250, 30-minute dry, and 30-minute sterilization. And then I will press start, and it'll automatically start going. The door will pop open when it's ready to dry, so it'll automatically vent itself. And then how to properly maintain the autoclave. Once a week, we do take all of the racks and all of the inner pieces out of the autoclave, and we wipe it all down with a mild soap or detergent, and make sure we can empty out the distilled water line and refill it. Make sure everything's cleaned through properly to make sure that it's sterilizing as it properly should. And that's it. So how do we know that a pack is sterile after we've autoclaved it? So one indication is that the tape that we put on the outside, which originally looks like this, has the black lines going across, which means that it is sterilized. Another indication is we can open this up. And earlier we had put our indicator strip inside of the pack, so we'll see what it looks like. So before there wasn't a black line, it was just all clear, and now there's a black line, which means that it is sterilized. So this pack was sterilized. In this video, I'll be demonstrating how to remove sutures from a patient. I have my materials, which is suture scissors, and then I also have thumb forceps as well. So her incision was on the top of her head. We removed a mass. So I'll start by, you can use your forceps to kind of grab the suture and pull up. And then you can get your suture scissors underneath it. So just grabbing it, pulling up, and then you can pull it out. Some of them might be covered with a scab. I'm just gonna leave that for a second. Okay. And then if needed, you can kind of clean the area. So this is pretty healed up. And looks good. There's no open areas of this incision, so that was a good time to take them out. If it looks like any part of the incision is not closed, you can always proceed to wait for it to remove the sutures and ask the veterinarian what they think about it, but hers looks really good. This looks like it healed well. Thank you. So after a patient's done surgery and before we send them home, we like to fit them for an e-collar that'll prevent them from licking the incision site. So a lot of times I like to grab two sizes that I think they might fit and see what best fits them. So I'll start with the smaller one just because it's hard for some dogs to use the larger collars. And for him, this one would be too small because his nose can get to the end, which means he could probably turn around and lick his incision. So that one will be too small for him. So then we'll go to this one and just make sure this will be tight enough on him and it's long enough that his nose can't reach the end and he won't be able to lick. So this will be, ours just Velcro, so we can Velcro that on. And this will be a good one for him to be sent home with and not be able to lick anything.
So in this video, I'll be going over discharge instructions. For most of our patients that come in for sedations, it's going to be spays and neuter, so it's pretty easy discharge instructions for the owners. We do give them a sheet that has all their discharge instructions on it. So, and I like to go over all the discharges with the owner as well. So I'll go over, the first thing I like to say is anesthesia can make the patient nauseous. So just give them a small meal frequently when they first get home, and make sure that they can hold it down and that they're not nauseous or vomiting or anything. And if so, just hold it a little longer. Same with water, because they can be nauseous. Just hold water for a little bit and offer small amounts every 2 hours or so. And then as long as they're keeping it down the next day, then they can go back to normal food and water. You also want to say that for 10 to 14 days, they need to restrict activity, no running or jumping or excessive exercise. And although most of them don't have outside sutures or all absorbable, they do need to wear a cone because they can lick the incision open. So I say keep the cone on at all times for 24 hours a day throughout that 10 to 14 days until everything's fully healed. And then the most common medication we'll send them home with is Carprovet or Carprofen. And that I do say to give with food because it can be hard on the stomach. That can cause GI upset, diarrhea, vomiting. So it's just important that they make sure they're not giving it on an empty stomach. They're giving it on a full meal. A lot of times we give the injection already in the hospital for pain meds after the procedure. So they're pretty much good for 24 hours. So the risk of nausea with that and them not eating when they get home isn't a concern. And then I always tell them that any risks associated with anything that might go wrong is redness, swelling, inflammation of the incision site that they need to look out for. Some swelling is normal, but if it's excessive, if there's any drainage coming from the incision, or if it just seems really red and irritated and whatnot, then they can let the veterinarian know or give us a call, and we can definitely see the patient back. So that's all the discharges I go over with an owner when they come to pick up their animal after a procedure is done. Thank you.
Thanks for watching.